Okay, so causes again, kind of a wide range, mixed results here, but some sort of concordance rate in twins. So there, again, some underlying genetic component. It also involves some abnormal reward processes in the brain. So similar to addiction, in the same way that you might, if you binge a lot of food and then purge it all out, um, you feel rewarded by that process in the area of the brain, like the nucleus accumbens. So if you're feeling that same sense of reward from doing it, you're going to keep doing it. But environmental causes are hugely damaging. They play a huge role. Um, Comparing your appearance to other people, having cultural attitudes and beauty standards. So there are often some gender differences in beauty standards as well. Women often feel this kind of uh, pressure to conform to a certain body type to be taken seriously in any sort of job, to put on makeup in order to have some sort of authority, things like that. Um, and it could lead, like those are just common examples, but it could lead to kind of more severe desires to change your body in order to please. Um, Definitely though, same, like this can also be true in males as well. As we saw with some of the examples on the previous slide, men also feel, have some cultural beauty standards as well. Overall, just comparing yourself to others, looking yourself in the mirror and not liking what you see is a huge problem, a huge cause of these different types of disorders. Often treated using psychological approaches here. So there's not really a biological medicine that will help you see yourself differently or help prevent an eating disorder. So it's most commonly treated using CBT, trying to restructure those thoughts, trying to give yourself back more control over your eating habits, training you to eat a more healthy diet, trying to prevent those feelings of needing to purge using some sort of behavior reward system, things like that. Group therapy is often super helpful too. A lot of therapeutic approaches can help you restructure these thoughts. Often note though, that's mostly helpful with things like eating disorders. Individuals with body dysmorphic disorder, however, are often pretty resistant to treatment. So if you were to sit someone down and say like, hey, like, these thoughts are unrealistic. These are, let's, restructure the way that you conceptualize yourself. They're often pretty resistant and they think that the way they're going to fix it is by doing more surgery or doing more changes to their body until they're satisfied. So a little harder to treat these types of conditions.